Welcome, everyone. Welcome to the live streaming of Anchor of Hope. My name is Dr. Esther Park. I'm a child, adolescent, and adult psychiatrist. And this is a meeting called Anchor of Hope, which is a now virtual gathering for anyone interested in improving our well-being by incorporating the message of God's love and power. And we desire to create a community where we can witness one another, experience unshakable hope and unprecedented healing. Anchor of Hope is sponsored by Oak Health Foundation, a nonprofit organization committed to raising awareness regarding mental health in order to reduce stigma and the prevalence of severe mental suffering. The goal of OHF is to deepen the understanding about the integration of Christian faith and comprehensive healthcare resources. So today is session 3 of our anxiety series, and it's going to begin with Dr. Steve Calleros. He is a child and adolescent psychiatrist with the part 1 of Why Does Anxiety Persist? Then it will be followed by a seminar by Dr. Meejan Park, a clinical psychologist. After that, we will have a Q&A session. So don't be shy to prepare your questions for that time. So now I will invite Dr. Steve. Dr. Steve.
Good morning, everyone. Our topic today, why does anxiety persist, is a very important topic. We can break it down into 2 parts. If you're dealing with, severe anxiety, you may have started your treatment. So it may be taking a while for you to start feeling better. So the first question might be, why is it taking so long for me to start feeling significantly better? And the answer to that would be the medications that we use, the selective serotonin reuptake inhibitors. Those medications take between 4 to 6 weeks before you start feeling significant relief of those symptoms. So the doctors will usually talk to you about those things. So sometimes people expect significant improvement, right away. Within the next couple days, but it's important to realize the medication, the effects that it has in your brain and nervous system need time in order to have the full effect. Some people start feeling better after 1 week. Some people start feeling better within 2 weeks, but waiting for the maximum effect of the medication, I would give it a good 4 to 6 weeks. Now, regarding the therapy, a lot of you, especially adults, have been living your life as an anxious person for many, many years, which means you think like an anxious person, you live like an anxious person, your family may all live their lives as anxious. So that type of lifestyle, that type of thinking takes a significant amount of time to undo. We have to change the way we think. We have to change the way we act. So for that reason, changing your thought patterns and working with the therapist is going to take time. And for that reason, it may be taking time for you to feel significantly better. One thing that might be helpful as well, in addition to therapy and medication, is relaxation techniques. So using relaxation techniques such as meditation, some type of exercise, yoga, going to the gym, those type of things can significantly lower your anxiety and be helpful in the immediate. Okay? Now, if you are in treatment and you've been in treatment for a while, and that includes therapy and medication, You might be wondering, it's been years. Why does my anxiety persist? Why isn't it not going away? Why is it still pretty severe? Why is it coming back? And we'll talk about that step by step. Now, um, one thing to take into consideration is people with anxiety tend to worry about many different things. It's not just one thing usually, it's about many different things. If it's one thing, we call it phobia. But if it's many different things and it's causing significant impairment, we would call that general anxiety disorder. And some people even get panic attacks, so we would call that panic disorder. But a lot of times, if we're worrying about one big thing, when that one big stressor gets resolved, then our mind starts worrying about other stressors. And so, because of that, because our lives are not simple, because our lives are filled with stress, a lot of times that will be driving your anxiety to continue. And that could be one of the big factors of why your anxiety is not getting significantly better. So it's very important for us to really get help and also to really pray about how can we break this cycle of worrying. Now, number two, if you're in treatment with medication, a medication adjustment may be indicated. Also, a therapy adjustment may be indicated. But we'll start with the medication first. First of all, if you're not on a medication, it's definitely important to consider a medication. And as we discussed last week, the selective serotonin reuptake inhibitors are usually the first choice. But if your anxiety is still persistent, the first step would be likely increasing the dose of the medication you're on. The difference between anxiety and depression, when it comes to anxiety, we usually have to use higher doses of the medication than we would in depression. Number two is if you're on a pretty high dose of the medication already, then I would consider a medication change. A lot of times we would switch you from one selective serotonin reuptake inhibitor to a different selective serotonin reuptake inhibitor. That would be option number one. Option number two would be switching you from a SSRI, which is the selective serotonin reuptake inhibitor, switching you from that to a different medication in the class of the serotonin norepinephrine reuptake inhibitor. Those medications are, for example, like Cymbalta. Now, we don't stop one medicine and start the other medicine all at once. We would do what I call a cross titration, which means we would decrease the first medicine that you're on while we're increasing the second medication. And we call that a cross titration. If that strategy doesn't work, the third option would be using what we call a combination treatment. And that could be like a selective serotonin reuptake inhibitor plus adding a medication called buspirone. And that would supercharge, or that would basically help the serotonin to be more effective. So that's a very good strategy. Another strategy could be adding benzodiazepine, such as lorazepam or clonazepam. So using combination of medications could also be an option. With the therapy, if you're already in therapy, you've been in therapy for quite a long time, it might be a good time to do a reassessment. Maybe reassessing the stressors that are going on in your life, reassessing maybe some expectations you have in your life, reassessing how you're thinking about things. What are your thoughts that are leading to anxiety? These are very important things to reassess if your anxiety is not significantly controlled. Now, another important consideration is maybe there's a biological factor going on. And what we would recommend would be getting a general physical exam with your primary care doctor, checking your blood pressure, checking your heart, checking your basic metabolic panel. And then also we would also suggest checking your thyroid hormone. If your thyroid hormone is underperforming or overperforming, that can definitely affect anxiety. So definitely getting a good physical exam, ruling out any biological considerations would definitely be important. And lastly, Dr. Mejan will talk more about this, but spiritual consideration is also very important. The spiritual battle is definitely real. And if you're already getting good treatment, good therapy, good medication, you're doing your relaxation techniques, but you're still having significant anxiety, it's definitely important to consider the spiritual battle. Satan can definitely be attacking you, and therefore it's important to seek spiritual help, spiritual counseling. A lot of times when we're believing the lies that Satan's telling us, it can definitely cause significant anxiety. If we're believing more of Satan lies rather than God's truth, that can definitely cause a lot of significant anxiety. So Dr. Mejan will speak more about that. So thank you very much. Thank you for your time, and we will see you next time.
Good morning, everyone. I am Dr. Mijin Park. I'm a clinical psychologist. So Dr. Steve Kairos went over really good reviews about why does anxiety persist in a biological reason and the psychological reason and also a chemical imbalance reason. So right now we're gonna go over with about how the Bible and the spiritual components of why does anxiety persist. So I wanted to all of us to read the Bible verses together. Romans chapter 12, verse 2. Okay, so do not be conformed to this world, but be transformed by the renewal of your mind, that by testing you may discern what is the will of God, what is good and acceptable and perfect. In a clinical sense, the anxiety, especially when we are treating our patients, is anxiety disorder. Oftentimes, those symptoms are characterized by feelings of worry or fear that are very strong enough to interfere with one's life or their activities. The Bible also, the meaning of anxiety has a different meaning. Often the Bible is talking about the roots of the anxiety from the Greek word. Sorry if I don't pronounce correctly, I apologize ahead of time. So the Greek word merimnao. The meaning of this anxiety the Bible is often talking about is divided into parts. Is as opposed to the whole. The anxiety is opposite from the peace. The peace is, on the other hand, is to joint or tie together into whole. You may know the word shalom. Right? So anxiety is opposite from the wholeness. It's divided into the parts and pieces. So then what makes our mind to be divided into the pieces? So specifically for today, I wanted to talk about the three components that why we experience persistent anxiety. The number one is the word. So as we talked about the Bible verses today, do not be conformed by the word. So the word means that the life that we experience or knowledge that we have, all those experiences that we have in the past, so we're combining it all together and creating it as the way of we're thinking, the pattern of our thoughts and of our mindset. This mindset sometimes is becoming a roadblocks. It created a certain expectations about our life, a certain expectations about other people, or sometimes a certain expectations about ourselves. So this mindset can create us to experience the persistent anxiety because it will allow us to be away from the true peace, the wholeness, knowing that God is in control, knowing that God knows everything. So we often experience the cultural standards. The worldly standard is giving us some forms of expectations. So my mom have a certain expectation about me. My husband and wives are having certain expectations about me. My friends have a certain expectations about me. So those expectations and a mindset can be huge components why we do experience the persistent anxiety. One example that I can give you that one of my teen patients recently was sharing with me that she has great anxiety looking at social media every day because when she sees that she doesn't have a like button, that she feels that people don't like her. If somebody is liking that heart button, then it is validation for her that she is okay and she is good enough. This is just one example how this culture and the standard of the world is giving us so much pressure that we have to meet in a certain expectations to make who we are and how we can feel about ourselves. Second components that I want to talk about is the flesh. The flesh, the Bible is talking about, is a desire to be in control. We wanted it to be in control in our lives. Everything that has to be in a certain way, right? Everything has to happen in a certain way. So we are premeditated certain things in the future that, oh, it's supposed to be happening that way. Oh, my friends has to respond in a certain way. So our fleshy desire always wanted it to do something to make that our ideal and magical thinking to be happen. And at the same time, Bible is talking about the flesh as our desire and selfish desire wanted it to be like God. This is the reason why when we are feeling out of our own control, we feel we're losing our sanity. Especially what we talked about it before, one of the things that I want to draw on the whiteboard is a timely manner, right? If it is a time, something that already had happened is the past. If something is happening right now is the present. Something hasn't happened yet, so what we call future. So we are constantly wanted to control something that we don't even know hasn't happened yet. So due to that, we are trying to do so many different things to control current life. It is our flesh desire, wanted to have something and wanted to gain something. It mainly is the self-control. Romans chapter 5 to 8 is talking about this concept so clearly. I will just read the verses for you. For those who live according to the flesh, set their minds on the things of the flesh. But those who live according to the Spirit set their minds on the things of the Spirit. For to set the mind on the flesh is death, but to set the mind on the Spirit is life and peace. For the mind that is set on the flesh is hostile to God, for it does not submit to God's law. Indeed, it cannot. Those who are in the flesh cannot please God. So this Bible verses is talking about the how much of a flesh desire is making us in trouble. Thomas Watson was quoted. I will just quote it what Thomas Watson said. This word we give can create trouble in peace, but God creates peace in trouble. Our flesh desire, where we're living on earth, this worldly standard is constantly giving us the anxiousness. The God's promise is we have assurance of answer to prayer. Although these flesh desires is constantly blocking us to enjoy true peace, God is giving us the assurance that we can pray in His name, then He will answer to our prayer. And also God is giving us this assurance of a guidance that we don't have to think about the constant about the future, what we needed to do, what steps we needed to take, because God is with us and His Spirit will lead us according to His plan and His will. This fleshy desire is constantly making us in trouble because we know ourselves that we cannot make all things imperfect because we don't know the future. Sometimes we will wonder why I have to experience this anxiety persistently, even with all those treatments that what Dr. Steve was talking about. The Tim Keller was actually mentioning that I love this quote. That's why I just wanted to share. He was mentioning that just because we cannot think of a good reason why God cannot stop the suffering, that doesn't mean that it cannot be any. That doesn't mean it cannot be lack of God's love. Yes, we may experience this flesh, earthly sufferings and troubles and pains. However, just because we cannot find a good reason, it doesn't mean God's love is lacking. And at the same time, disbelieving God doesn't make us our anxiety less, or it reduce our anxiety. Third things that we cannot omit to understand spiritually why our anxiety is persist is because of the devil. The devil, the meaning of this devil is liars, right? Divided. As we talked about it in the beginning, the meaning of anxiety in the Bible often talked about is the divisions. Not only devil and the Satan, it will constantly divide us from the peace. He's constantly making our mind to be into the pieces. So worry about so many things. At the same time, he is accuser. He's accusing us constantly about our identity. 2 weeks ago, Dr. Esther was talking about the assurance of a salvation. Satan's goal, because Satan knows that he cannot pluck us away from God's hands, from the salvation. Only thing that what Satan and devil, this evil enemy, can do is making us in trouble and very ineffective our decisions every day so that we can be miserable and not experience peace. That's the only what enemy can do. We have to believe and also have assurance of this victory that God has given to us. When Jesus died on the cross and resurrected, he proclaimed he is finished, which means this enemy has no power. As our experience of our mind and our understanding and our knowledge only can limit it to the past experience and also what's going on in the present. Satan is the same thing. He will constantly will use what happened in the past, the experience that we had, memory that we had, so that he's making us enable to do or use the assurance of the salvations and guidance, the answer to prayer, and this victory that God has given to us. Because Satan doesn't know what's going to happen in the future. Satan has no idea God's plan and God's will and God's purpose for us. So he will constantly use this past, that what happened, any negative experience, any negative memory that we had, he will constantly accuse us and make us not feel good enough. But our God is omniscient. God knows everything beyond the space and time. God exists outside of the human concept of time, but also inside of the time. Our God is omnipresent. Our God is omnipotent. This is the God that we believe. This is the God we have in us. Yes, we may experience this persistent anxiety due to the worldly experience that we have, only knowledge that we have, the mindset that we're constantly having as something on our own expectations, rather than the way God views of us and about his future. Yes, because of the flesh desire that we have, we'll always constantly wanted to have in control of our lives. But God has given to us the promise. He knows everything more than us, about us, and including about our future. And this enemy will not stop to lie and accuse us about who you are, who God is. Romans chapter 8:28 was saying, we know that in all things God works for good of those who love him, who have been called according to his purpose. It must be difficult if some of you are experiencing the anxiety, especially clinical anxiety. Some of you may have so much pain for so many years. Why my anxiety doesn't go away? Why my depression doesn't go away? Why all these sufferings of what I'm experiencing doesn't go away? Yes, we may have the questions. Oftentimes, even as a clinical psychologist, sometimes I don't know what to say that when my patients are going through so much pain and suffering. Sometimes I just have to be silent. I just have to be present with them. But I know one thing for sure. God loves us, and God knows more than what we can imagine. And God will put all these things together. Not only good things, not only bad things, but good and bad all together. God will work for good. I hope all of us, whether you have or you are going through these difficulties and current anxiety currently, or you may have a content in your life. But all of us have a one hope together and believes that God is with us and God knows everything. So the persistent, the anxiety, we may not know fully, even including biological and psychological, neurological, social, or even including spiritual. We may not know full or 100% or perfect answer, but we know the truth. God loves us. God will make everything for good. Thank you. we're gonna have a Q&A. So please write down your questions if you do have. That we will do our best to answer to those questions. So I will invite Dr. Steve and Dr. Esther to the room.
Awesome. Thank you so much, Dr. Meakin and Dr. Steve. All right. So while we wait for people to post any questions up here in our live chat, today I did come prepared with questions as well to get this discussion going. For those, I know I'm a voice behind the screen right now, so some of you who may not know my face, I am the manager here at the clinic that is Oak Health Center, and I've been here for the past maybe 8 to 9 years. And in those 8 to 9 years, I definitely have witnessed, great testimonies of our patients who have emerged from treatment, getting better. But on the other flip side, I do recognize there are those who struggle with their anxiety very persistently, and it almost seems like it's like a lifelong struggle that they'll have to deal with. And so the first question that I wanted to open up the floor with is, for those who feel like they've tried everything, whether it be treatment in the form of, individual therapy or group therapy or whatever they may be, or maybe even those who have tried treatment like medication treatment, and they've tried so many different things, but they still struggle with this persistent anxiety. I want to ask on behalf of them, what hope do they have, or do they have hope in terms of getting better?
Sure, I'll volunteer to answer first. I'll take this off for clarity. I've had many clients who experienced that, and I was probably maybe one of the clinicians to treat cases like that where they've gone through so many different treatments. And I'll give you one example. Well, first answer is yes, there is hope. There is always hope that anxiety can get better and will get better. But in those cases where it's so persistent and it seems like nothing is working, the general rule of thumb is really go back to the basics, or go back to the beginning and start over in terms of assessment and evaluation. I did have one case of a child where things were really getting rough and not getting better. I was struggling to try various different regimens. And to the credit of the mom, not even to me, is going to another medical doctor or a general medical specialist and found out that there was a undiagnosed medical problem. And the symptoms were not very evident. So it was just more of like the hunched check. And lo and behold, that was one of the biggest reasons for the issues continuing in that child's life. So after that medical treatment was included along with the treatment I was providing, things started to get better at that point. So sometimes it's the wrong diagnosis. Sometimes the medication, the classes of medications don't fit the person's chemistry and there are side effects, or it's ineffective. And so maybe I'll come up with another answer of how sometimes we figure that out.
Thank you, Dr. Esther. I think just piggybacking on what you said, a lot of times there's more than one diagnosis going on at one time. So that's why doing a reassessment is a good idea, and why there is hope, because sometimes there might be an underlying depression going on, which might be fueling the anxiety. There might be like an eating disorder going on that you're not even aware about. So a lot of times these anxiety disorders and mood disorders, they go together. And that might be a reason why you're not improving. But there definitely is hope. And don't be afraid to ask for a reassessment, because that's always a great idea.
And also, the research has been shown that the compare group, that someone who's receiving the treatments and not, right? So the research has been shown, and statistically, 85% of the clients who receive treatments was getting better compared to the people who don't receive the treatment. So again, clinical trials and the research has been proved that although it may not be the way you expected, it may not be quick result, but it shows that it is actually hopeful that it will get better.
I want to add her point of those who receive treatment will get better. I want to say consistent treatment, because there are people who say, I've gone to so many different therapists, I've tried so many different meds, but they only went to 2 sessions, or they skip every other day of their doses. Like, that kind of inconsistency will not bring results. It's almost like saying you're going to go to the gym once a week and you're expecting changes. So I always emphasize, we can't judge if a medication is working well or not, or we can't judge if a psychotherapy modality is effective or not, unless there is some consistency with that. So just wanted to add, sometimes the persistence of a symptom like anxiety would be because of that.
I actually wanted to add one more thing as a psychologist. Treatment is very, very important for you to go and receive help. But at the same time, I'll always ask our patients who are going through the difficulties, they also has to participate and make a commitment too. So they cannot rely only on the medication or therapy. They also needed to mindfully change their environments, their relationships, or anything that is make their life stressful, right? So it has to, again, medication and then therapy could be one other components to get better. So we needed to assess not only that part, but in a whole area of our lives, so that we can holistically get better.
And if you have anxiety, you must be in therapy. You really, if you're not improving and you're only on medicine, that's not treatment. You must be in therapy, because a lot of anxiety is the way you're thinking. You think like an anxious person, you're going to feel like an anxious person. So please, you must be in therapy.
You know, on that note, then, I'm going to ask a really practical question on behalf of our audience. I feel like the people who are well versed in mental health treatment, this might be a very easy answer, but maybe there's some people that are watching that it's very foreign to them in terms of seeking mental health treatment. So someone who's been told you need to get therapy, you need to see somebody, but it seems so hard, or they don't even know where to look to find one. What should a person like that do? Where can they seek resources in terms of getting help?
It's a good question. Any licensed clinician, so for example, psychiatrists with an MD degree, a DO degree, a psychologist who has a PhD and a license under the Doctor of Psychology, PsyD, PSYD, licensed marriage family therapists, LMFT, and licensed clinical social worker, LCSW. Those are the main examples of the licensed clinicians who are all trained to do an evaluation. What that means is you would meet them in an interview process where you share with what you're struggling with, and then the clinician will guide you in that interview with further questions to distinguish and diagnose what may be the main cause or the assessment. And so at the end of, it's usually an hour long, and at the end of that hour, they will come up with a preliminary assessment. For example, we call that differential diagnosis, meaning it could be generalized anxiety disorder, it could be social phobia, or it could be major depressive disorder. These likely diagnoses are developed, and then the treatment recommendations will follow that. So, for example, Dr. Steve pointed out very clearly, which I completely concur with, is if it's a primary anxiety disorder, psychotherapy is indicated. And during that interview process, the interviewer should determine what kind of psychotherapy might fit the person's situation. So, for example, if there are a lot of cognitive distortions, which means like incorrect thoughts, then cognitive behavioral therapy might be that route. And if there is a background of trauma as one of the sources causing the anxiety, then it might be a trauma type therapy, such as EMDR or trauma focused CBT. Those are just different guidelines, right? And so after that, the interviewer, whether it be a physician or nurse practitioner or a therapist, would guide and provide referrals of who might be a good fit for that client.
Oh, so I think you just mentioned it right. Like, how can you find these therapists? I think you just mentioned it, but you can go through your family doctor. You can say, hey, I'm having some trouble with anxiety. Can you refer me to a clinician? So you can go that route, or you can just call your insurance and say, I'm looking for some mental health treatment. Can you give me some referrals? Or you can even go online and look for those psychiatrists or psychologists or PsyD or LCSWs.
Mm-hmm.
And I'll just plug in our own clinic, not because I'm trying to gain more business or anything like that, but at Oak Hill Center, because it's affiliated with Oak Hill Foundation, those who are desiring even just one evaluation, because they heard about it through an event like this, Anchor of Hope, or any other talks that were given, sponsored by Oak Hill Foundation. If you mention where you heard about Oak Health Center, then even up to 30% discount will be provided. So I just wanted to encourage those who have nowhere else to go, then you can come to Oak Hill Center. And we are doing virtual sessions starting even from the evaluation session if needed. And if payment is truly an issue, then that's why you talk to Donna, the one who is guiding us in this Q&A right now.
Mm-hmm. And also, I wanted to encourage to specific population, the cultural beliefs and stigma is so strong to open up our own problem or our family problems to somebody else who's totally stranger. So a lot of Hispanic culture, Asian cultures, and some other cultures are believing that, because we are growing up with the collectivistic culture, that we will be it will be shameful to share about our problems, our family issues to others, right? So, but oftentimes because of those stigma, some of the clients are coming to me are sometimes is coming with the too much of issues or severe issues. The issues could have been dealt with earlier, and it could have been actually healed very quickly. So I wanted to really encourage for all of you who are having these cultural backgrounds and a stigma about the seeking mental health, please seek early on. Then you don't have to go through many sessions or even many other treatment, because it could be small things, especially for your children's, especially for your relationship. If it is early on, especially when our patients are younger, it could be easier for them to get treated quickly. So I know that me as a Korean, how difficult it is visiting somebody who you don't know, to opening it up, your difficulties and challenges. It will help you to relieve all the burdens and stress that you may go through.
More questions?
Yeah, so it's kind of cool. While we're going through this, we have a few clinicians in our live chat who have been chiming in terms of their recommendations as well. And so one of them is that definitely if you know people in your lives that have already sought treatment and sought help, it's a good place to start. Word of mouth is always a good place to start to find a good provider. And another clinical psychologist here says that there's a saying that sometimes the arrest of decline is success. And so it's quite possible that an individual's anxiety could possibly have been worse if they hadn't been in treatment. And so definitely I think we've all agreed here that there is great benefit in terms of seeking professional help for big and small issues alike, right? I'm going to shift gears here because we do have a question now that's not just about the clinical aspect of what we talked about today. I'm going to bring in the spiritual here because the question says this: if God knows everything about us, the past, present, and future, then why does he let us live it? And it's the comment that he wrote after this is, it's like watching a movie you have already watched before.
Mhm. So I will start with that because I mentioned that on our talk. Again, I may not know the answer. I will say why God doesn't stop. But again, I will borrow Tim Keller's the comments here because it was actually comforted me so much while I was preparing today's message. Just because we don't know why God doesn't stop doesn't mean that God doesn't love us. We may not know the answer why God doesn't stop right now, or even coronavirus. This coronavirus is hurting so many people, and it's so many different way and the layers. But we don't know why God doesn't stop. But that doesn't mean that God doesn't love us. That doesn't mean that God doesn't know what he's doing. That will be my answer for today. Because that is theologically and humanistically is a very, very difficult questions. Who am I sitting here can give you answer? Why? Because God said so this and this. This is God's will, God's purpose. That even in itself is a very shallow answer. I'm very afraid to give you just that answer. But the only thing that I know for sure, and I believe in 100% that God knows. And God has a plan for us. Probably at the after this process, after this pandemic, we may find some answer, or we may not find some answers. But I know that God loves us. And God has his own timing.
Yes, even very strong Christians, like Apostle Paul, who wrote a lot of the New Testament, he went through a lot of difficulties. He had a lot of trouble. He had a lot of difficulties. So just because we're Christians does not mean that everything's going to be perfect and we're not going to go through problems. Jesus himself said, in your life you will have trouble, but take heart because I've overcome the world.
Can you repeat the question one more time?
Sure. It says, if God knows everything about us, our past, present, and future, why does he let us live it?
What does he let us live the problem?
So I want to challenge the question with another question. Is that from assuming that God has ill intention regarding living through it, right? As if like he is some sort of script maker and he just wants us just looking down on us and enjoying how we're living through it and the struggles we go through. And I don't think that's the God that we know. And while he created us in this image, he also created us to have free will, and also a mind to think. And so while he knows ultimately, because he's above time and space, he knows, of course, ultimately what will happen. But during that journey, we actually have a choice to continue to trust in him during that time. We have a choice to enjoy life and look at problems in a certain way, perspective. That's what we talked about 2 weeks ago. That's our choice, actually. Whether or not our salvation is firm and secure. At the end of the day or at the end of the life, we're going to go to heaven if Jesus is in my heart. But from now until then, the actual choice is even mine to continue to enjoy, continue to be filled by the Spirit by listening to his word, to enjoy praying, personally and with others corporately, those are actually my choices. It's my choice to go to worship or not go to worship. And then based on those choices is sometimes how the enemy while on earth is going to deceive me or not. The stronger I am by being filled by the Spirit with the truth of God, that's why I can't do it on my own. I need to do that in worship, in corporate worship, which nowadays is online for everybody. And to keep hearing that, otherwise I will not be strong enough and be able to fight against the lies that he keeps throwing at my head. So that's my 2 cents.
Very good.
I will give you, this is a kind of public display, but I'm compelled today to share a little bit of my testimony here. About 25 years ago, when I became a Christian, I have 2 brothers and a younger brother. I have one younger brother and an older brother. My younger brother had a heart surgery, when he was in high school. And during the surgery, he had medical incidents that he couldn't wake up. And then after 3-4 months of a coma, he woke up, and but he was a different person. He became complete disabled, cognitively, physically, and we couldn't even communicate. He barely recognized our family members. And during the time, I didn't know why. I still actually don't know why God had to allow our family to go through that. Even today, we are going through that difficulties. Even today, my brother is in the hospital. So still, I don't know the clear reason. But through all those process, after I accepted Christ, I was questioning the same thing. Why did God allow? If you are the God, if you are loving God, why did you allow this issue or this problem to our families? Why this problem doesn't go away, and even until today? But one thing that I realized, the question in itself was wrong for me. Because disbelieving and arguing with God constantly doesn't make us feel better. Disbelieving about his will and his purpose for our family and our brother doesn't make me have a peace. So throughout all those years, like what Dr. Esther said, and God was giving me the peace that God knows. And I have to put my faith in him, that God is making my life right now is for some purpose. So that whoever going through some hard times and difficulties, I can be careful what to say. And he's using even my difficulties and sufferings in the past, and good and bad all together for his good work. So that's what I believe.
Amazing. Thank you for sharing that vulnerable part of your life, Dr. Mijin. We do have one more question, and it asks, with the current pandemic, what anxiety level would you consider normal? And when does it become considered a behavior that's overly anxious?
I think if it starts impairing your life, when it becomes clinical is when it starts impairing your life, when it starts causing you not to be able to sleep at night, your appetite, you're not eating well, you're missing work. That's when it's becoming overly anxious and clinical.
I know some people are so anxious that they are not leaving the house at all, because it is recommended to take walks around the block and see sunshine, and some are not are too down or are too upset, so they don't connect virtually. And I know there are some people who don't have internet, and so that makes it even doubly difficult. To the point of, for example, functioning, like they're not bathing, they're not washing, or they're overly washing, like the obsessive compulsive symptoms of causing an increase of excessive hand washing to the point where their skin is breaking. So that level is excessive. It's too much.
As we talked about it before, anxiety is not all bad, right? So some anxiety is good. This pandemic, this COVID-19 is a serious thing. But if we are following the instructions, social distancing, washing our hands, and wearing the masks, and be careful being around the vulnerable people, right? We all have these guidelines. If we can follow those guidelines, we will be okay. The reason why even we are careful today is not because of my own sicknesses, because I may transition this virus, asymptomatic, the coronavirus to somebody else. So we are careful to taking care of one another. That's why we are following all those guidelines. But some people who are excessively worrying about these issues and leading into the other thoughts. What if I die? What if I die alone? Those kind of train of thoughts are constantly leading into the unrelated to the COVID-19. Then it will definitely influence the ineffectiveness of our lives and also avoiding the situation that what we needed to do.
Great. Thank you so much. I think that was a very complete answer. Hopefully that helped answer this question as well. I'm going to take, because we have one more question that just popped up. It kind of goes back to our original question that we talked about in terms of the practical ways for people to find appropriate therapy. So this is a question that just came from now. It says, in searching for a therapist, recently there is a new type of therapy that has come about, which is therapy via texting. I'm not sure if you guys are very familiar with that. And this person is wondering, is there evidence-based success or effectiveness in that type of therapy?
I don't think there are any studies done yet about that. I won't say that that's ultimately the most effective, because there are a lot of other aspects about psychotherapy. Even there's a difference between doing psychotherapy sessions in the same room versus video sessions versus phone call. But I will say, to the credit about the effort of texting therapy, is if I were that therapist and I can and the client, the only way that client will talk to anyone is through texting, then I would at least take the advantage to begin engaging in the text conversation. And if things come up through that texting conversation and somehow there's a rapport built during the texting, then I probably would eventually lead that person to become more and more interested in meeting a therapist directly and having a direct conversation. So to me, that would be one of the advantages and maybe the positive aspects of texting. But to end with it, I'm not too sure.
So research has been proved that telemedicine through the video session is almost the same effect that you are with the in-person therapy. But the research hasn't shown, or even I don't believe that actually had a research on how much of effectiveness and efficiency using via text. So I just wanted to say it according to what I know, the research studies. So video sessions, they prove that it is the same effects like in person, but not. I'm not aware of a text message for the effectiveness of outcome.
I mean, I could see the advantage of it because there's that immediate response if you're in a situation where you need like an immediate response. So I could definitely see the advantages to it, but probably there just needs to be more research.
Great. So that wraps up all of the questions that have come in. So I'm wondering, it's funny, the past few times that we've done this live stream, there's always one person who asks, is there a verse, a Bible verse that we can share with our audience so that they can hold on to that for the next 2 weeks until we meet again? So I'm going to ask that question on behalf of the audience. If you guys can leave them with maybe a verse or two
Okay.
in regards to what we shared today about the persistent anxiety and how we can combat that with the word.
Mhm. So I will share a couple of verses that I couldn't fully go because of the time. We're talking about the assurance of a guidance when you are unsure that how God is guiding us of our lives. Please look into the Isaiah chapter 58, verse 11. And also verse that we talked about today, Romans chapter 12, 2. And assurance of answer to prayer that we talked about a little bit is John chapter 16, 24. And if you wanted to know, read the assurance of a victory, how Jesus took care of that issues, Luke chapter 10, verse 19. And also always my favorite verse is Philippians chapter 4, 4 to 11.
If you are interested in viewing the previous ones because you could not view them before, this is the third recorded live stream, and the other two are listed on our website at oakhillfoundation.org. These are also shareable, if you know what I mean, to send to other people or to share the links with other people if you feel that this might be helpful for them. So if that's all for today, thank you so much for joining us. Thank you for sharing this with others if you think it will be beneficial for them. We really are praying for everyone's health and safety in this time.
See you next time.
I loved you.
See you May 9th.